Oh. Warm welcome to one and all again to the CSIR interactive sessions today under the aegis of Indo-German Research Day being organized by DWIH New Delhi, DVR. Today in the CSIR sessions, we would be presenting Council of Scientific and Industrial Research, in short CSIR India, your innovation partners in India. We would be having three sessions. We'll be having two sessions, one starting from 3 p.m. to 4 p.m. India time, and the other one starting from 5 p.m. to 6 p.m. India time. We would cover in the sessions and general overview, including existing partnerships with Germany and opportunities for building India-German S&T cooperation. This would be presented by Dr. Ramaswamy Bansal. Welcome, ma'am. And she's a chief scientist and the head of International S&T Affairs Directorate at CSIR headquarters. The next session under the next program under the first session is we'll be presenting research and development portfolio of CSIR. Now, this would be presented by Dr. Vandana Bisht. Welcome, ma'am. She is a chief scientist at Innovation Management Directorate at CSIR headquarters, and she would be presenting the projects and various missions that at present are ongoing for building collaboration with our German partners. The next session, that is starting at 5 p.m. to 6 p.m. will be on research development and translation, where technology portfolio and contract research capabilities will be presented by Dr. Vibha Malhotra Sani. She is the head of technology management director and head innovation protection unit, and we'll introduce you at that time. Without much ado, I request Dr. Rama to please take forward the sessions and present the general overview of CSIR.
Thank you very much, Mohit. Esteemed participants, colleagues and friends, on behalf of CSIR, I extend a very warm welcome to each one of you to this sessions of CSIR today as part of the India-Germany Research Day. We all know that science and technology have been behind the Industrial Revolution that boosted economic growth of all nations. And today, like never before, it is again for science and technology to take the center stage and give rise to a sustainable revolution in this ever-changing world. And CSIR, the Council of Scientific and Industrial Research of India, stands exactly at the center stage, well placed to accelerate sustainable growth at a global level. CSIR is well known to both German and Indian S&T fraternity. However, with changing times and needs, the priorities change, expertise further strengthens and expands, and many new milestones get achieved. I'm here to briefly introduce with my organization, CSIR India, give you a broad overview of its infrastructure, major research areas, research facilities, existing partnership with Germany, and opportunities for furthering India-Germany partnerships through CSIR.
Just give us a moment, please.
Technical issue, please be with us. Right. So CSIR has a pan-India presence. It is the largest industrial R&D organization and has immense strength of 37 multidisciplinary industrial research institutes spanning almost all areas of science and technology, having highly talented human resource, vast R&D infrastructure, and strong connect with industry and the government. CSIR has technology prowess of almost over 900 products and technologies, which are most at 5 to 8 TRL levels. and more than 3,200 active patents are currently in our credit. Since establishment of CSIR in the pre-independence era in 1942, CSIR has been pursuing its objectives and contributing to advancing the knowledge, fueling economic growth, catering to strategic needs of this country, and achieving societal welfare. It has been contributing to the society by providing public good through human and research capacity and capability development, through societal good through rural and frugal innovations, strategic good through technology services and solution support, and industrial good through empowering the industry with its technologies and knowledge base. CSR is one of the top innovators in India. I feel proud to share that there is a bit of CSR in every industry in India, be it in the form of skilled manpower, the technology, process, or operations. These industries encompass almost all sectors of economy: drugs and pharmaceutical, chemicals and fertilizers, energy, electronics, genomics, leather, building, aerospace and defense, mining and fuels, food processing, agriculture, health and wellness, aroma and floriculture, rural and cottage industries, minerals and metals, and infrastructure. CSIR has been catering to the requirement of both rural and urban sectors. Some examples are here in front of you from the urban sectors, such as the Indian coal gasifier, the roads that have been built by CSIR in the border areas, in the hilly terrain areas, the DME fuel pilot plant, the road built using the steel slag, the waste of steel manufacturing process, Hansa NG, a two-seater aircraft, fuel cell car, the biojet fuel. And some examples from the rural sectors are the low chilling requiring apple variety called Anna, biopesticides for wilt Fusarium in crops. The pest has been controlled using these pesticides. The lemongrass, the seaweed cultivation, the lavender cultivation, tulip cultivation, also marigold cultivation as part of our floriculture mission. CSIR has been aligning its work, its effort with not only the national missions, but also with the global sustainable development targets set up by the United Nations. And for this, what we do, we have adopted a thematic approach for leveraging the strengths and opportunities and for integrating multidisciplinary complementary talent and infrastructure for addressing unified goals of the country's need through R&D for sustainable development. Next, please. This slide shows some of the indicative developments and some of our initiatives from the mining technology sector, the farm mechanization, energy, aerospace, oceanology, chemicals and petrochemicals, instrumentation, affordable healthcare, waste to wealth, water, nutritional foods, or standards. I'm not deliberating more on the technology part because you will have more detailed presentations in the session later today. Some of the new and ongoing missions are very focused program, multi-institution consortium projects on these areas of green hydrogen, carbon capture, utilization and sequestration, AI and terahertz, semiconductor fab, aroma and floriculture, and antimicrobial resistance. In addition to carrying out research and development work, CSIR contributes immensely towards building a robust R&D capacity and capability in the country through its academic arm, CSIR. CSIR has been providing higher education in specialized technology sectors. CSIR's technology incubation centers across India are supporting startup ecosystem. Its human resource development group is providing EMR support and fellowships and scholarship. Its Human Resource Development Center supports capacity building, both intramural and extramural. CSIR maintains regulation and standards in India, which ensures the quality control. It hosts major research facilities, and it caters to the capacity building of all ages from school level itself. CSIR has been generating new knowledge, which gets documented in many prestigious science journals. Often our articles are published on their cover page. Many services are also being provided by CSIR. These include the technology-oriented services, the S&T capacity and capability building services, and the analytical services. Examples of technology service are depicted on this slide. These include energy audit, preclinical testing, structural health monitoring, control blasting, water mapping, 3D printing, mechanical testing, calibration, and product certification. Some of the analytical test facilities available within CSIR family include biomolecular and biomaterials analysis, chromatography and separation, etc., etc. Some of the major national level facilities are also depicted on this slide. One such is the CSIR's Trisonic Wind Tunnel facility, which was used for testing the Chandrayaan-3 launch vehicle recently. And the lower pictures are from our microbial type culture collection and gene bank in one of our labs, and CGMP pilot plant for extraction, formulation, packaging of traditional herbal medicinal formulations. The CSIR has 12 technology and business incubation centers that have been promoting entrepreneurship development and startup ecosystem in India. Some of these are sector specific, while others are sector agnostic. These have been set up under the programs of CSIR itself and also under the schemes and programs of central and state governments. CSIR deeply acknowledges the importance of international collaborations and is promoting these collaborations for promoting and developing science, technology, and innovation. CSIR is a partner to over 55 research and technology organizations, which includes funders from over 40 countries. Partnership encompass research and technology collaborations, providing technology, HR building services. The slide also depicts the global footprint of CSIR in terms of research collaborations, HR capacity building, and the industry connect. Next, please. Germany is a very precious partner for CSIR, and we greatly value and acknowledge the academic, research, and technology progress of Germany. Next. Also, CSIR institutes have been participating in the intergovernmental programs. This slide shows the programs that CSIR has itself developed with various agencies of Germany, which started in 1965 with German Academic Exchange Service, DRD, and later in 1974, the year in which India and Germany established their science collaboration framework, CSIR was there to collaborate through KFA, later through Forschungszentrum Jülich, and now through BMBF and DLR International Bureau. In 1975, a sector-specific collaboration started in the area of aeronautical sciences with DLR Germany, and later Fraunhofer Gesellschaft, though the letter of intent was signed in 1994, both sides recognizing the importance of technology connect. In 2019, we graduated from a letter of intent to a full-fledged memorandum of understanding. And I'm happy to mention that through various programs of CSIR and also the intergovernmental program, CSIR has completed over 212 R&D projects that have led to development of stable scientific contacts, generation of new knowledge, products, processes, and technologies. Next, please. Talking about our linkages with DRD, we boast of our connect with DRD. We were the first from India to support exchange of scholars through DRD since 1965. And happy to mention that over 632 CSIR and 364 German scientists have exchanged visits, have visited their partner institutions under DRD CSIR program. Over 500 DRD fellowships have been backed by CSIR researchers, and over 60 projects have been formulated through this platform. In the recent years, in last year, we have revitalized our collaboration through a agreement of cooperation, which supports all areas of science and technology and provides for exchanges from both sides of up to 15 scientists for a visit from 14 days to 3 months. And of course, the exchanges would be on bilateral terms. And I'm happy to share that though the agreement was signed only last year, we have already supported jointly 2 projects. I won't get into the details of those projects. With the BMBF, we have the last project that just got completed late last year was on urban wastewater, fecal sludge and septage problem in Indian cities. And this collaboration has been very successful. The technologies developed have already been implemented in India. I'll come to that in a later slide. Next, please. With Fraunhofer Gesellschaft, we had a very successful workshop that encompassed several areas, including battery technologies, water, sustainable buildings, and advanced production technologies. This has strongly advocated for developing a formal collaboration arrangement, and accordingly, a memorandum of understanding was signed in 2019, which provides for a very unique level of way of funding. Joint funding is available for collaborative R&D on futuristic subjects, and funding is required from industry or other stakeholders for TRLs 3 to 5 and 4 to 9 technologies. Progress, I would like to mention here that we have been having industry-specific webinars to showcase the industry, what the 2 parties together can bring on plate for these stakeholders. Areas covered were sustainable buildings. We have also been having topical interactions. Some of the areas are mentioned here. And we have been talking on various smaller, big, mid-sized projects and deciding how the 2 parties can work together closely and serve the industry, not only in India or Germany, or even the third countries. I'm very happy to mention this slide shows all the collaborative projects that CSIR has so far completed since 2018. And as you see, out of 198, 31 projects, which is the largest number of projects completed with any one country, has been with Germany. Next, please. And the number of visits also you see from this slide have been to Germany again, be it from our CSIR lab directors or the senior level scientists of CSIR. These are those some of those project partnership outcomes, specific technologies that have been developed and deployed on several sites. One of them is with the Central Structural Engineering Research Center of CSIR in collaboration with Germany. A decentralized and modular textile reinforced concrete waste water treatment plant has been developed and deployed on 2 sites. And the project under BMBF, which I just mentioned, 2 sites, the technologies have been deployed. One on grey water and black water treatment technology, and the other on modular on-site treatment system for grey water and black water treatment in CSR NIST campus itself. Another development under BMBF program is from our National Aerospace Laboratory on vibration energy harvesting using multi-layered piezoelectric stacks for devices, which are lead-free. And these are some of those current broad priorities, which are priorities for CSIR, and we would encourage to have collaborations in these areas. And these include, I think there are priorities not only for CSIR, but these are global priority areas currently. One Health, antimicrobial resistance, water manufacturing, critical metals and minerals, genome editing and microbiome-based therapeutics, agrochemicals, specialty chemicals and coatings, waste to wealth for circular economy, semiconductor and sensors, equipment supply chain, AI and ML, Industry 5.0, and next generation energy devices, generation, storage, and utilization. While we have our direct program with Germany, we also would like to use the existing funding mechanisms, be it through the through DST DRD window or through the Indo-German S&T Center, the IGSTC, which promotes collaboration, promotes and supports collaboration in various ways, including fellowships, scholarships, conferences, workshop, and also 2+2 mood projects. And I'm happy to mention that the center has developed many schemes which are women-centric for inclusive development. Next, please. Some of the modes of collaboration that we would like to pursue with Germany include joint research projects, subcontracting of projects to CSR institutes, joint contracts of industry, identifying relevant Indian industries in areas of mutual interest. I would like to mention that not only Indian industries, it is industry in general, and joint R&D program and scholar exchange, staff exchange and training programs, networking, and capacity building. CSIR had been one of the first, I don't want to say one of the first, but had been the first scientific research organization of India that started, as I mentioned, pre-independence era, and thereafter all other institutions came in. 37 institutes divided into 5 major sectors: biological, engineering, chemical, information, physical sciences. And I would like to now take you through a video which will show a little more glimpses of CSIR. Can we have the video, please?
Yes, ma'am.
One of the oldest civilizations in the world, the Indian civilization has long and rich tradition of science and technology. The modern times have witnessed the growth and development of many scientific and research institutions across the country. One of the premier scientific and research institutions in India, the Council of Scientific and Industrial Research, takes the legacy forward. And today, CSIR celebrates over 80 years of game-changing innovations. CSIR was established in 1942 and is one of the oldest scientific institutions in the country. Today, under the leadership of visionary Prime Minister Shri Narendra Modi, CSIR continues to be in service to science and the nation. CSIR also has the esteemed guidance of Dr. Jitendra Singh, the dynamic Minister of Science and Technology. The journey continues from writing India's most democratic success with ink of innovation to creating India's first prototype of hydrogen fuel cell car. The agriculture sector witnessed some important innovations over the years. CSIR built and commercialized the first indigenous tractors, Swaraj, giving a big push to green revolution. Recently, CSIR also launched the first e-tractor in the country as well. The revolutionary fervor of CSIR continues to date, transforming India's status from importer to exporter, and also shifting focus to agri-tech startups. To increase the income of farmers, the Aroma mission of CSIR has played an important role in introducing high-value aromatic and medicinal plants into new areas. In the recent years, CSIR enabled widespread lavender cultivation in Jammu and Kashmir, creating a purple revolution. In early years, when India faced a technology denial era, it stood high on morale and supported food manufacturing sector with its best of the time indigenous technologies. It pioneered customized parallel computers when supercomputers were either too expensive or not to be sold to India. The prestigious organization is enabling availability of safe drinking water at low cost. Its heli-borne surveys of the recent years are addressing the clean water woes faced by the country and enabling mineral explorations. Over the years, CSIR has set milestones in health sector. providing low-cost affordable healthcare to the country. Thanks to the contributions of CSIR in chemical technology, India owns the title of Pharmacy of the World. CSIR has played a crucial role in contributing to Government of India's missions with its many innovations. CSIR is also working on solving the country's problem of rare genetic disorders. Health emergencies have always been cared and catered with utmost priority by CSIR and its various labs. CSIR has also contributed to Chandrayaan-3 mission, the main launch vehicle LVM-3 that carried out Chandrayaan-3 module was extensively tested and characterized in CSIR's National Aerospace Laboratory. CSIR made significant contribution to the energy sector by developing first indigenous lithium-ion technology in India. CSIR has also developed indigenous technology to produce biojet fuel, which received approval use in military aircrafts. Prime Minister Shri Narendra Modi dedicated the 10,000 tons per annum hydrazine hydrate plant in Gujarat and the wax de-oiling plant in Assam based on CSIR technologies. Not just that, CSIR has done several innovations to provide clean energy solutions to the nation and to meet the SDG goals. To manage waste, CSIR also introduced several waste-to-wealth technologies. Its AGR technology on conversion of vegetable waste to energy is used in large vegetable markets. CSIR's technology has been used to build steel slag roads. Other recent initiatives include biodegradable cutlery and developing tiles from agricultural waste. Leather Technology Mission, launched by CSIR, nurtured specialized human rescue and revived 270 tanneries and saved 2.5 lakh jobs. It has swept a step ahead and is working on Indian footwear sizing system. Soon, India will have its very own footwear sizes. CSIR has been the front runner to provide affordable, indigenous and innovative technologies for the food security, energy security, water security, healthcare security, strategic security and related areas. CSIR has been and continues to be on its toes for disaster mitigation, saving lives of common people and developing after-effect mitigation technologies for earthquakes, landslides, cyclones, etc. During COVID-19 pandemic, CSIR's interventions played a crucial role in bringing innovative solutions during pandemics. CSIR contributed to the creation of India's very own co-vaccine, the COVID-19 vaccine, for disseminating scientific innovations and inventions in the country to the masses and the scientific community. Various journals, books and magazines are published for decades. In the past 5 years, CSIR has published over 25,000 research papers in various SCI journals of repute, and it has also been granted around 2,500 patents in India and abroad. Also, exhibitions and activities are planned from time to time to inculcate deeper understanding of science in the masses. CSIR is the powerhouse of scientific research and invention and continues to excel under the leadership of CSIR's first Women Director General, Dr. N. Kalaiselvi. In the Amrit Kal, CSIR marches on with Prime Minister Shri Narendra Modi's vision to make India a developed nation by 2047.
Right. So with this, I have come to the end of my presentation, my talk, and I hope that these informative sessions, my presentation and the sessions ahead today will help you learn more about CSIR, its capabilities, and the ways in which we can collaborate. We are there to support and answer to all your queries. We'll be very happy to receive your queries and proposals. Thank you very much for your attention. Thank you.
Thank you, ma'am. This, we now move on to the next session. That is by Dr. Vandana Bisht. And we'll, if in case there are any questions, you can please drop them in the chat, or you can raise your hands. I think Dr. Kadja has a hand raised. Ma'am.
Was by default. So sorry. Go ahead. No question from my end. Sorry.
Thank you. Thank you. So in case if there are any questions, you can raise your hands maybe after Dr. Vanna's presentation, and you can also drop them in the chat, and we'll be happy to take them after Dr. Vanna's presentation. And ma'am, a warm welcome to you, and we look forward to listening to you. I would request you to please take the sessions ahead.
A very warm greetings to all the participants, my colleagues from India, as well as all the participants from Germany. And I'm very much glad to have this opportunity to share with you CSIR developments on technologies and know-how, whatever is being developed in recent times, what we have experienced through our new projects, and all those things. So I myself is Dr. Vandana Bis from Innovation Management Directorate at CSIR headquarters. And since Dr. Rama has already given you a vast overview about our organization, so you are well now aware how many labs we have and how many themes we are working on. So as we are already working on a diverse areas of science, so the labs, 37 labs of CSIR, they not only work in their own domain areas, but also in the interdisciplinary areas of science. So though we have demarcated them into 5 different clusters, biological, physical, chemical, engineering, and information sciences, but all these labs, they have interdisciplinary approach and they work in 8 different themes of CSIR, and which is already being pointed out by Dr. Rama. Anyway, I will also give an overview of that. And with this, I am just, yeah.
Share
Yeah.
your
Yeah.
Slides.
Yeah, I'm sharing my slides. Yeah.
Perfect.
Is it visible? Yeah. Okay. So coming to all the things that, as I have already mentioned, that all our labs are also working in their own domain areas, and also interdisciplinary areas. They are very much free to choose their own research programs and research projects through the government funding as well as from the external funding, whether it is a public funding or private funding. Apart from that, CSIR headquarter, which has a superior role on all these labs, we undertake our own mission programs and our own new project development programs, which are usually priority based or on a top down approach, where the government tries to or government expects from CSIR to do work on. So we make different type of research projects from our own itself, and where we involve all our laboratories also wherever they are required, as well as the external partnerships, external institutes of India, outside CSIR, as well as industries. So different types of projects that we undertake at CSIR are mainly categorized into 5 categories, which is highlighted in this slide. One is a mission mode program, where we synergize the best competencies in CSIR labs and outside institutions. The priority and frontier R&D areas from the national needs, ongoing national missions, and priority of the government, discussions with DGCSR, etc. All these things decides on the top-down approach to decide on what research projects we need to undertake at the higher level, the national level. These are mainly the mega projects which get funded from CSIR headquarters to to basically deliver the solutions for the society or industry. The focus of delivery for the mission mode program is in the form of solutions or from technologies or some policy related matters. The lead that we undertake to develop in these mission mode programs are from TRL 4 to TRL 6 level. So where we show the demonstrate the preliminary processes and to the pilot stage. So these are the mission mode programs we take. Next is fast tech translational projects that we undertake at CSIR, where we usually focus on TRL 6 and 7 level development. The leads from the other basic research projects that we take, we adopt them, or we actually take them or invite them to develop certain technological solutions or product development, so that the technologies are accelerated from the lab to market. So the solutions which are, or technologies which are developed in these programs are get ready for commercialization. So our CSIR mandate, though, is not a commercialization, but we usually make products which are a prototype, which are ready for commercialization to be taken up by industries, and they bring it to the market level product. Then here we also encourage the involvement of industry partnership. Most of the times industry also joins with us, but at times they are also participating and in a participating or collaborative mode. We have another type of project category which is called major laboratory projects. Though our CSR labs have their own projects, small projects, but here if they have some unique ideas where they can utilize the competencies within the CSIR to undertake research for indigenization of technologies or for advancement of research in a particular domain area, then these get funded from CSIR headquarters, and here it is they are being developed and implemented. Among these projects, major laboratory projects, we also support specialized facilities at CSIR laboratory which need continuous R&D support. It's not just making a specific facility, but the run the facility by showing the research in that facility. So all these specific unique projects that we take, it comes under major laboratory project category. We have another set of project categories, New Millennium Industry Technology Leadership Initiative. This is the lone public-private partnership model in CSIR, where we involve industries from the very beginning, and we also provide them a soft loan. Both the collaboration here exists between the academic institutes, research institutes, and industries. So the grant is being provided to the government R&D institute, and we provide soft loan to the industry. Basically, they are Indian industries have unique ideas and they want to bring the products to market. Here, the R&D in association with these industries have exclusive technology delivering projects, and it may be possible that there is a joint patent on these type of projects, or it may be an industry patent that has the flexibility we maintain. If the industry has their own lead and they have their own patent, we support them to develop the project, to develop the product to bring to the market. So the partner industry usually take up the lead for the commercialization. So here also we try to develop the technology to a ready to commercialization level, and then scale up is being done at the industry premises. Now coming to the next category of project, the focused basic research or FBR or niche creating projects. These type of projects, they are actually the basic science project, and here it is understood that unless we do the advanced or basic research, we will not have a knowledge pool where to bring some new leads to the level of product development. So this is something like a reservoir of research knowledge, which actually leads to some of the leads which goes through in a mission mode program, then in a fast track program, and if provided, if they are in collaboration with industry, they may also go into the Nimitli program, that is public-private partnership model. So all these categories, though we have decided, but they are a bit of intercalation between these two categories. So we, through these categories, we ensure that there is no overlapping of certain programs. The programs or the research project, they move from one step to the another. So these are the five categories. Now coming to the research theme areas, which is already being highlighted by Dr. Rama, but still I am now categorizing whatever the ongoing mission and ongoing projects which have been categorized, which are of focus and which is being monitored and implemented through headquarters. They are being categorized under theme areas. In aerospace, electronics, instrumentation and strategic sector, we have now recently funded 12 fast track projects, 4 missions, in the areas like advanced devices, lab instruments, aerospace materials, AI-enabled systems, and terahertz technologies. In civil infrastructure and engineering theme area, we have 9 fast-track projects and 1 mission, energy efficient, climate resilient buildings, and many other new in pipeline. So all these projects, it is worth to notice that all these projects are not a single laboratory project, but these are networking of CSIR laboratories. In fact, one or the other external institutes are also involved in these projects, so that there is a proper networking and end-to-end development of particular solutions. Under the mining minerals and metals and materials, that is 4M theme, we have 12 fast-track projects funded and 1 mission. The area being advanced materials, devices for optoelectronics, biomedical, and strategic applications. We have chemicals and petrochemicals theme, CLP theme, where 11 fast-track projects and 3 missions are there, working on bulk chemicals for industrial and pharmaceutical applications, agrochemicals, specialty chemicals, catalysts, sustainable additive fillers, etc. We have in energy and energy devices theme, 12 fast-track projects have recently been funded and 5 missions are ongoing. This encompasses the areas like plastic depolymerization, carbon capture utilization, redox flow battery, hydrogen generation, storage and utilization. Under ecology, environment, earth and ocean sciences and water theme, we have 11 fast-track projects being funded and 2 missions are ongoing. This includes drone-based air and greenhouse gas monitoring, upscaling of wetland-based sludge and septic treatment plants, waste to wealth and sustainable packaging solutions. Under agri-nutrition and biotechnology theme, 12 fast-track projects and 2 missions are ongoing, which includes nicotine-less tobacco plant development, industrial enzymes, nutraceuticals, functional food, bioactives from seaweed, aroma, floriculture, etc. Now, in healthcare theme, there 10 fast-track projects are ongoing, 7 missions, and 1 limitly, that is public-private project. It includes areas like implants, phytopharmaceuticals, sickle cell anemia, cohort studies, drug development, APIs, antimicrobial resistance, and microbiome studies. Now coming to the success stories, which I would like to highlight in some of the recently closed programs under CSIR Nimitli, a public-private partnership model. Here I am showing 2 products, Sepsivac and handheld micro PCR. These products have been developed, started from scratch, and the development though took a long time because completely indigenization of technology is there, and there is starting from scratch. We have a molecule, and we have done all the experimental bench work, plus then followed by clinical trial, and then launching the product by the industry partner to the market in the form of Sepsivac. So Cadila Pharmaceuticals, they have launched the Sepsivac. It was the industry partner in the project, and this is an immunotherapy treatment for gram-negative sepsis management. Another, this handheld micro PCR, under this project, again, all the work knowledge has been translated to develop this micro PCR machine for diagnosis of various diseases at low cost settings. And now this device is prevalent so much within the India and has been adopted by all the government medical agencies as well as our Indian and state governments. And the product is being marketed worldwide by Mall Biodiagnostics. The one thing I would like to point out here, that the industry Mall Biodiagnostics here started from scratch as a startup in this project. And through this startup, they have now evolved into a major industry with a worldwide presence. So these are some of the success stories which we feel proud of. Another success story under again public-private partnership model, already Dr. Rama had highlighted about the fuel cell vehicle. The fuel cell program of CSIR have started in 2004-5, and now it is gaining so much of importance that our previous leads have now led to the generation of starting from demonstration of 5 kilowatt polymer proton exchange membrane fuel cell to 10 kilowatt and then to 40 kilowatt, so that they are able to run one car and then later bus. And now recently country's first indigenous green fuel cell inland waterway vessel has been launched by our Honorable Prime Minister. And this involved the fuel cell that has been developed under this Mitli program. And the industry partner that was involved with us in the program since the very beginning is one of the partner in developing this indigenous green vessels. So this is something from you, though the development has encompassed maybe around 10 years of development, but we have seen the success as of now. So it's very much, we feel proud of. Another is a dental implant technology. At present in India, most of the implants which are available are imported and they are very expensive. But because of the competition, though there are so much imported plants are there, but they have a very big population which cannot afford such imported implants. So thinking that in mind, the project was started way back around 10 years back, where we have developed our own indigenous dental implant system, starting from designing to fabrication to all the clinical trial and then launching to the market. We have come a far away. Now the indigenous implant is available in the form of iFix and it is being marketed. The one point to note here is that we have a one industry which is the first industry which has indigenous manufacturing setup for dental implants. So we have come a long way in this public-private partnership model, and it is very much it feel to be proud of. Now coming to our internal programs where most of the CSIR labs are involved. One of the mission in theme healthcare is sickle cell anemia. Most of the part, maybe around 4 to 5 states in India are the population is crippled from this disease, and especially the tribal population. So this mission sickle cell anemia, though now it is very much taken up by our government and is being promoted by government, but CSIR has shown its presence in this R&D and counseling, as well as all the societal involvement in treatment and facilitating the patient for all these treatment for this genetic disorders. CSR was 6 years before we have started this program, when it was not even heard of even in our country, was in a lower level. Now we have come to a far way in this program also. We have our own whole blood PCR or dried blood PCR diagnostic, which is very much cheaper as well as fast, and it diagnoses the not only the helps in screening, but quickly diagnose the sickle cell presence in the population and direct them to treatment. Now our diagnostics has been validated by around 10,000 samples. It has been validated and the technology has been transferred to the in an Indian industry, and they are manufacturing the kits for these diagnostics. We also, under the advanced research, we have now our own kinetically enhanced engineered FN-Cas9, which is now being exploited by our labs in a major government program for targeting the high genome wide specificity, robust editing for gene correction in humans. So at present, one of the project is being funded by Government of India, which encompasses the clinical trial using this CRISPR system so that the disease can be cured permanently. So we are currently being involved in this. Maybe after 5 to 7 years, we hope that we are able to make a big breakthrough in this. Again, under theme healthcare, we have started a very promising cohort study program, and this is one of the maybe one of the largest cohort study in India itself. And I cannot say about the other countries, but in India, it's one of the largest study because it is a pan-India presence is there in this cohort study. CSIR being quite a big family with 37 labs scattered all over our country. So our CSIR family employees, they are being used as a subject in this cohort study. And the cohort study is being done for cardiometabolic disorders. We want to generate data for a predictive medicine and the cardiometabolic status of Indian population residing in different places or different regions of India, which has different types of not only the climate but also the way of living, the food, and everything is different. So the prediction, this data will be so useful that it will be able to tell about the genetic data setup and how we can be able to, through machine learning, can able to predict the vulnerability of any person towards a particular metabolic disease or the lifestyle disease, which are now currently on the rise. So as of now, 10,000 samples have been collected from all over India. Again, under theme healthcare, we have active pharmaceutical ingredients mission, and we have already few number of APIs in place which have been transferred to industries, and they are under production also. Two I have highlighted here for paracetamol para plant, and one is azelaic acid from oleic acid. These APIs are vastly used in different types of drugs, and they have been successfully now being produced by the industries, also have been uptake taken by industries, and we have already worked till the pilot plant setup. Under the theme agri-nutrient biotech, we have currently an ongoing mission on nicotine-less tobacco plants. Tobacco products are available worldwide, but they have a presence of high amount of nicotine, making the users addictive to that. So the focus was on to develop a nicotine-less non-transgenic tobacco plant through use of CRISPR-Cas9 technique. And so that once we are successful in developing such varieties, we can use those varieties to develop all these. Since we cannot avoid these products, the products will be there, will be made. So, but we will have a nicotine-free product which will not be addictive. So significant achievements have been achieved till now, as the 70% reduction in the nicotine content of a variety has been achieved. The constructs have been developed and they are being transformed in the commercial varieties of tobacco. We have a phytopharmaceutical mission under theme agri-nutri biotech. We have certain botanicals. We are developing drugs from them in a scientific manner, with the more importance on use of plants in our lifestyle in a drug, and lesser use of chemicals. We are adopting all our traditional knowledge into developing drugs from these botanicals, because in our Indian traditional knowledge, these drugs have been found or already reported to have some certain beneficial indications in certain disease targets. So, but these have to be developed scientifically. So at present, we have these 8 to 10 leads which are under different phases of development. The investigation new drug studies are being undertaken, and in some cases, the clinical trials are underway. So through these mission, we are trying to generate scientific evidences for traditional use of botanicals. Again, we have mission nutraceuticals and food safety. Again, as I told, that Indian tradition is very much vast, having all household even know what are the uses of food as a medicine. So we have undertaken this mission to have an holistic approach to overall health and wellness, and by using food as medicine. And so again, we have generated, in fact, scientific evidence for Indian traditional knowledge and wisdom on plants and foods for targeting immunity post-COVID in different health indications. Scientific approach has been used to develop plant-based nutraceuticals. Some of these I have highlighted in this slide. They have been developed and they have been scientifically proved that these nutraceuticals, if taken consistently, they improve our health. Not only the nutraceuticals, we are also targeting food safety for consumers, for regulators, and empowering the industries towards the food safety and adulteration. So in this also, we have developed around 15, 16 important technologies have highlighted here, already ready and for licensing too. And it's CSIR lab. They are also trying for some startups and for industries for uptaking these small technologies, so that our consumers, regulators, and industries are empowered, and they know that people there is need for safety of food and adulteration. Under theme EED, that is energy devices, we have a mission coal where we have been able to develop 1.5 TPD oxyblown PFBG plant for high ash coal gasification. The aim here is to convert the coal to methanol and through the formation of syngas. So at various stages of this conversion of coal to methanol, all the end-to-end solutions, starting from their conversion, the catalyst involved and the processes involved, everything is being taken care of in this mission. And at present, we have uh, CSIR Simfer having developing 40 to 50 kg per day syngas to methanol plant, and CSIR IIP is developing 25 kg per day carbon dioxide to methanol pilot plant. And our industry partner Adani Power is on board on this project. Again, mission hydrogen technology, it is also an ongoing mission, and since we have already developed the fuel cell technology, which forms the basis of hydrogen technology. So we already have technologies in place regarding the hydrogen generation, and now work is being for advancement or making the next generation technologies in three verticals: hydrogen generation, storage, and utilization. 15 CSR lab, the CSR NCL as nodal lab is undertaking this implementation of this program, and it is also complementing the Government of India program. The industry partnership is on board, and strict monitoring is being done for the project. And certain development and certain the products which have come up through this ongoing programs are already highlighted here. In the mission carbon capture and utilization, again with the climate change, we need to sequester the carbon which is increasing day by day in the atmosphere. The vertical of the mission thus includes carbon capture, utilization, and sequestration or storage. Again, there is a combined efforts of 14 CSIR labs in this program. We are developing catalyst, adsorbent, industrial fly ash waste for carbon dioxide capture and sequestration, using the marine microalgae for carbon sequestration, and that biomass, which is the byproduct of this carbon sequestration, can be utilized elsewhere. So the program is ongoing, and two development that has come up is being shown here. Again, mission plastic depolymerization and upcycling. The plastic waste is becoming a menace, and it's very difficult to control them. So for the solution, we have in this mission we are trying to develop segregation and sorting system of different types of plastic waste, and where it is already a full scale system capable of offering 100 to 200 kg per hour of sorting out of the plastics has been developed and has been installed in one of our CSIR labs. And now efforts are being undertaken to convert this plastic waste into diesel at IIP. And the production of diesel has been done with 80% throughput and 63% conversion using segregated plastic waste. Now these bioproducts of this plant is also being used in different types of other industry product values, products which are used in different industries, as well as we're trying to improve whatever the diesel is generated to make into BS4 to BS6 version. So the lab scale process development for value-added products by thermal catalytic depolymerization of virgin polyolefins is being undertaken here. 3 patents have already been filed in this program, and the program is ongoing. Under the theme CLP, chemical, leather, and petrochemicals, we have mission bulk chemicals, agrochemicals, specialty chemicals. Here the slides have listed out the CSR intervention already developed. They have all in place, and it has been, most of them has been transferred to industry also. Again, the agrochemicals have been developed, and we want that agrochemicals which are safe for environment, these are the targets here, and these have been developed and transferred to industry. So in the chemical sector, CSIR has been intervening in all segments from specialty chemicals to agro, fertilizers, petrochemicals, and bulk chemicals. So the program is again ongoing, and we are trying to make all the value-added products for the industry. Under the theme aerospace, we have indigenous development of technologies and for advanced devices and laboratory instruments. Most of these instruments and devices are imported in India, and they are very costly. So at times when these devices are being used in the medical sector or it is being in the lab, so the government has initiated the indigenization of all these devices so that we have our own technology and start production in India itself. So many indigenous development for self-reliant India has been developed, which has been highlighted here in this blue and white LED dispenser cathodes for various applications, and they are magnetron for various applications. They are mercury-free plasma-based and UV source and power supply and infrared-based pyroelectric sensors. We have certain devices, medical devices in prototypes in place, and efforts are being made that some startup or industry take up them and started producing them. Again, these medical devices indigenization, a specific program for medical devices was taken up in the form of mission under the theme aerospace again. And some three devices I have highlighted here. We have a dialysis machine, which is fully indigenized. We have an advanced closed loop control system for electric assisted tricycle. We have a smart handheld colposcope device for cancer detection. So these three have been developed, and there are 15 prototypes of other varied devices are in place, which are ready for commercialization, which need to be taken up by the industry for production. Now, the other missions and ongoing which are in pipeline, we are AI-enabled technologies and system, climate resilient buildings, aerospace technologies, redox flow batteries, specialty chemicals, terahertz technologies, aroma and seaweed floriculture mission. These all missions are ongoing, and one or other slides we have already highlighted on this. We don't have that much of time that we specifically highlight on each and every program. It can be done in a separate forum. Now, some ongoing in pipeline, we have certain other programs which I have highlighted in these boxes, Indigen Med and AI-based industrial manifestation, loitering munitions, antimicrobial resistance, packaging challenges, indigenous manufacturing of machine and assembly lines, tapping of critical metal material, recovery of metal from spent batteries, digitization of traditional practices, of both agriculture as well as mineral metals, and then unified digital identity and web presence of CSR. Some of these ongoing projects and our pipeline which are being processed for implementation in this year. I can only think of some proposed areas of collaboration, some new areas of collaboration with under healthcare, CAR-T cell, there is CRISPR technology, there is PROTAC technologies. CSIR is undertaking all these programs at their smaller level, but maybe CSIR scientists will be benefited if we have collaboration with the developed countries like Germany in these technologies, and our CSIR scientists are able to learn and start applying these technologies in a much better and much faster manner in our country. Under EED theme, we are very much interested in carbon sequestration in geological formation, how to track, how to store the carbon which is generated under the ground. In the advanced aerospace material, we are interested in terahertz technologies. These technologies we have just recently started and we're trying from a scratch. And maybe the collaboration will enable CSIR India to help to move further with a greater speed. And 6G, AI, and ML. So these are some future collaborations I can think of now. There may be other areas of collaboration, and collaboration are very much required in the ongoing project which I have already highlighted in my previous slide. Thank you very much for your patience hearing.
Thank you, ma'am. Thank you, ma'am, for a wonderful presentation. the audience, if there are any questions, you can drop in your questions in the chat box or raise your hands, and we'll be happy to answer them. And for the audience who are listening us on our YouTube and Facebook channels, you can drop in your questions in the chats, and we can get back to you. You can drop in your email also over there, and we can get back to you from there. So in case any questions, happy to answer them. Otherwise, parallel sessions are ongoing, as Dr. Kadja has mentioned, and I think people have gone over there. Thank you, ma'am, once again. I would like to thank both Dr. Rama and Dr. Vandana for such informative sessions, and look forward to building Indo-German collaborations ahead. Thank you once again. Thank you all for joining. Have a good day.
Thank you very much.
Bye. Bye-bye.